Most people believe that if a doctor recommends surgery, it must be the right decision. After all, the surgeon is experienced, the hospital is prepared, and everything seems certain. You're told, just sign here. But what if I told you that for many people over 60, the real danger isn't always the disease? It's the surgery itself. Because I have seen something most patients never get warned about. People walk into the hospital with a manageable problem and walk out permanently changed. Not healed. Changed. Over the years, I began to notice a pattern. A man enters with back pain and leaves unable to walk. A woman survives heart surgery but loses months of her life to complications no one mentioned beforehand. And that's when I started asking a deeper question. Not, can this surgery fix the problem? But, can this body survive the recovery? Because here's the truth no one explains clearly enough. As the body ages, it doesn't just fight disease. It struggles to survive the stress of the treatment itself. And today, I'm going to walk you through 5 surgeries that carry serious hidden risks for seniors, along with the questions that could completely change your medical decisions. Think of your body like a car. A brand new car and one with 200,000 miles might look similar on the outside. But under stress, they respond very differently. For decades, medicine treated older bodies the same way as younger ones. Same procedures. Same expectations. Same recovery timelines. But inside an aging body, everything changes. The heart works harder under anesthesia. The lungs take longer to recover. The kidneys slow down medication processing. And the brain, this is where it becomes surprising. Many older patients experience something called postoperative cognitive dysfunction, where memory, focus, and clarity can remain impaired for weeks or even months. And yet, this risk is rarely discussed openly. Now let me be clear. Age alone is not the problem. I've seen 80-year-olds recover faster than people in their 50s. The real issue is something called frailty. Frailty means the body's reserve has dropped below a critical level. And this is incredibly common. Nearly 40% of people over 75 are considered frail. That number rises dramatically after 85. So the real question is no longer, can you survive the surgery? It becomes, can you survive what comes after? Number 1, open heart surgery in frail patients. Open heart surgery can save lives. There's no doubt about that. But here's what most people don't fully understand. During this surgery, the heart is stopped completely. A machine takes over the function of your heart and lungs. For a strong, healthy individual, this is manageable. But for a frail older adult, it becomes a full-body stress event. Studies show that complication rates can reach 30 to 40% in frail elderly patients. We're talking about stroke, kidney failure, long-term confusion, extended ventilator support, and in high-risk cases, up to 15% do not survive the first 30 days. Now here's the important part. There are alternatives today, such as less invasive catheter-based procedures. Which leads to one powerful question, is there a less invasive option for me? That one question can change everything. Number 2, aggressive spinal surgery. Back pain is incredibly common as we age. And more often than ever, the solution offered is surgery. Spinal fusion. Hardware. Multi-level procedures. But here's what the data shows. In patients over 65, complication rates can exceed 40%. And the complications are serious: infections, blood clots, hardware failure, new damage in surrounding spinal segments, and here's the most surprising part. For many older patients, These surgeries do not provide better long-term pain relief than physical therapy and targeted treatments. Same results. Much higher risk. Sometimes, the best surgery is the one you never needed. Number 3, major cancer surgeries. When people hear the word cancer, the instinct is immediate: remove it. And that reaction is completely natural. But the real goal of treatment is not just removing disease. It's preserving quality of life. Take complex procedures like pancreatic surgery. These operations can last 6 to 10 hours. In younger patients, they can be life-saving. But in frail elderly patients, the surgery itself may become the biggest risk. There are cases where the tumor is successfully removed, but the patient does not survive the recovery. Not because of cancer, but because the body couldn't handle the operation. Studies show nearly 1 in 5 elderly patients undergoing major cancer surgery experience fatal complications. So the question becomes, what are my non-surgical options? Because sometimes, those options offer better outcomes. Number 4, elective joint replacement in high-risk patients. Joint replacements can be life-changing. They restore movement, independence, and comfort. But timing is everything. In older adults with multiple health conditions, the risks increase significantly. Especially blood clots, lung complications, infections. The key here is not avoidance. It's preparation. Optimizing health before surgery, blood pressure, weight, glucose levels, can dramatically reduce risk. Some hospitals now require prehabilitation programs before surgery, which raises an important question: is my body truly ready for this right now? Number 5, emergency abdominal surgery. This is the one you don't choose. It chooses you. And that's exactly why it matters. Emergency surgeries in seniors carry some of the highest mortality rates in medicine. Sometimes as high as 30 to 50%. Because the body is suddenly overwhelmed. Multiple organs are under stress at the same time. And the system can spiral quickly. So what can you do? 2 powerful things. First, never ignore symptoms like persistent abdominal pain or changes in digestion. Early action prevents emergencies. Second, have conversations with your family before a crisis happens. Discuss your wishes, your priorities, your definition of quality of life. Because those decisions should never be made in panic. What you must do before any surgery. Before any major procedure, ask these 4 questions. Number 1, what happens if I don't do this surgery? Number 2, is there a less invasive option? Number 3, what will recovery look like for someone like me? Number 4, what is your complication rate for patients my age? These questions shift the entire conversation. From passive acceptance to informed decision-making. Let me tell you about a patient. A 71-year-old man who was told by 3 surgeons he needed open heart surgery. He wasn't afraid of the operation. He was afraid of losing himself. He had watched his wife go through surgery and never fully recover mentally. So we explored alternatives. Medication, rehabilitation, careful monitoring. He chose that path. For years later, he's hiking with his granddaughters. Smiling. Living. That is what the right decision looks like. Here's the most important truth I can leave you with. A surgical recommendation is not a verdict. It is the beginning of a conversation. You are not powerless. You are not just a patient. You are a decision maker in your own health. And sometimes, the best outcome doesn't come from doing more. It comes from choosing wisely. If this video helped you see surgery in a new way, take a moment to like this video and subscribe. It helps more people discover this information. And I want to ask you something important. What question would you ask your surgeon before a major operation? Write it in the comments. I read every single one. And if this message could help someone you love, share it with them. Because one conversation can change a life.